Well, I wonder if we can ask the panel to introduce themselves. Janet, would you start for us, please?
Sure. I'm Janet Porter, and I'm a recovering hospital administrator. And until about 18 months ago, I was the Chief Operating Officer of Dana-Farber Cancer Institute in Boston, and now I'm a consultant with Stroudwater.
I'm Myles Lash. I'm the President Emeritus of Provenance Health Partners, and I too ran large teaching hospitals when I was in operations.
My name is Jack Friedman. I am the Chief Executive Officer of Providence Health Plans. I've been there about 25 years. And in a new role, I'm also the Senior Vice President for Accountable Care for our health system, and trying to figure out ways to put accountable care models in place.
Wonderful. Well, thank you to all of our panel for being with us today. All right, so as we get started, what I'd like to do is ask the three of you to reflect on what do you believe to be the distinctive competencies that are going to be required of persons who hold management and leadership roles in health sector organizations? Janet, would you start for us, please?
Sure. One of the most interesting developments in the last 10 years as systems have consolidated and become billion or multi-billion-dollar organizations is that most of them have now invested in developing leadership framework, a leadership competency model that is unique to that system's goals, and that then turns around and really serves as the underpinning for the management and leadership development they do, both with managers and physicians, and also serves to underpin their performance improvement systems. And those models usually address the gamut of competencies from strategic thinking, visioning, etc., all the way through execution, with detailed, expecting people to be able to be competent in developing and executing business plans, etc.
Gentlemen, what do you think?
Well, I think a good leader is a good communicator. He or she has to have the ability to convey a sense of value, and has to have the ability to empathize with the mission and vision of the organization. You know, the leader is the one who stands in front of the room and conveys these important thoughts. So if you want to have the objectives of whatever the task is, you need to have it conveyed properly, and with a degree of charisma. We'll get into leadership, but you're going to need to be able to shine through at those moments.
Okay. Jack?
Yeah, Myles, I think that's well said. I think when I look at the best leaders in our health system over the last 25 years, they are people that are wonderful communicators. They paint a vision of the company that motivates staff. They're strategically adept. They look for ways to collaborate, often with our competitors. They press business models in a way that I think is innovative. And so I think that's right. I think the great talent is to get people motivated, excited about their work, and painting a future that they can rally around and then manage to.